Let's see if we know how to go to the next slide. Oh, we do. Super. Okay, so here we go. What are we talking about today? If I don't see the chat in, I don't see anybody saying hi, so I'm hoping there's people here besides Michelle. That Michelle, if you're the only one, that's awesome. Here's the most adorable picture ever of a tired baby. You'll see a lot of these pictures of babies and children sleeping or in stages of exhaustion, because we need to talk about why do we sleep. Sleep is critical. We're going to talk about our tongue being an orthopedic organ, and I'm using Restream. So in any case, I would like to also talk about how we can help, right? So this isn't something new. This isn't news, first of all. It's old news. And also, before I leave this slide, I want to make sure everybody understands orthopedic means moves bones, okay? Orthopedic surgeon works on bones. And next we have, and of course, this is all in honor of World Sleep Day, which is today. So who am I, and how did I get here? What's my authority to give you any of this information? Is that I have been practicing dentistry and doing orthopedics for my entire career. I'm also now a diplomat of the American Board of Dental Sleep Medicine, which is over 100 hours of study. I graduated dental school in '96. I also have a diploma from college as a biotechnologist. Just did 2 years in university, and that's why I don't have an undergrad degree. Went on to dental school. So I love bugs is what that means. Microorganisms, of course. And there's lots of those in our mouths. So how did I get here as well? It wasn't on my own. I just didn't open a book and, figure out what the heck everything is. But there was a lot of learning involved and a lot of people who taught. And I'd love if you want to take a look at Airway Circle. And this is the brainchild of Renata Nem, who is incredible hygienist who does myofunctional therapy and teaches people about, and professionals like myself, about how to help people with these problems that we're going to talk about today. And in fact, BioLase, which I'll talk about a laser later, but that's the QR code on the bottom there is for BioLase, so that you can understand a little more about the specifics of the laser. Because once we get a little bit talking about tongue tie, I just want you to know that these two organizations have everything you would want to know about all of this. So let's go on here. And also, this is how did my personal story get here? Lots of dentists get focused on lots of different things in their career. Personally, though, these are my 5 kids. My oldest there in the middle is at his wedding this past September. And my daughters and both my boys have all had some type of breathing problems. And as you can see in the notes there, we suffered. My oldest, who got married, has sleep apnea. We're correcting that for him. Yes, correcting. He is going from a 29 AHI. Seems like it's down to 12, but we have to know for sure. So if you can relate to any of this, or if you know people like this, these are the kids that I like to see in my practice, right? So what does happen when we sleep, right? So much is happening. So sleep is actually a newer technology, research area. And it is critical. So you can't go without sleep for very long. But besides that, it's not about resting. That's what we need to shift our understanding. Because if we're just looking at resting, then we are not going to get everything that we need from sleep, right? It's cleaning out waste products in our brains. It's making sure that we are repairing and regenerating cells and hormones. Now, in particular, never mind this video or GIF, I guess it's called GIF, whatever you want to call it, is particularly disturbing because of the soft drink. Well, I'm hoping it's milk in, okay? We're going to say it's milk in there. But this is one tired kid, right? Now, in particular, though, let's talk about infants, right? I'm sorry if I jumped over there, just had to comment on this crazy video, little GIF. I loved it because this is exactly the kind of kid I want to see, right? If this is your kid all the time and they're always falling asleep, That's what I can help you with. Now, newborns sleep most of the day. And do you know that 50% of their sleep is REM sleep? And now that you know that you are maintaining brain function with sleep, most of that occurs during REM. And in fact, you're not maintaining brain function as an infant. As a newborn, you're developing your brain. So there's that process of neural connections is happening during sleep, right? Everything is forming, growing in the right fashion. If it's not getting to go through REM, then it's going to have poor neural connections or lack of neural connections, right? So do you think this kid is getting any quality sleep? Not so sure, right? So I hope everybody's enjoying this so far, and I'm not putting you all to sleep. We'll move on to the next. So this is my little twinny poos, my twin girls. They're over mid-20s now, but it was quite a lot of fun. Tiny little bassinet, 2 little babies fitting in there. This one here on the right, when you're looking at the screen on the right, they're not identical. And she didn't have breathing problems so much, but she's having reflux problems. And we are addressing that through airway issues, hoping to anyway. The one on the left, my 2 little girls, the one on the left has had terrible breathing problems. And that's especially why I have wished I had known then what I know now. So their brains are developing, right? She was your typical 6 weeks old in the hospital, wheezing. So what kind of behavior problems can kids have from poor sleep? Obviously, irritability, they're going to be trouble concentrating, right? The process is getting interrupted is the problem, right? So all of these things that are going on at night when you're either developing your brain or just doing systemic kind of reconfiguration and maintenance don't happen because those usually happen during REM. And if you have problems with your sleep, that's what's usually getting interrupted. Now, in particular, we're going to talk about breathing during sleep. So if your breathing is interrupted, it's a much bigger problem than just not getting enough oxygen or not getting enough rest. You're not a car. You don't need to just shut down for a little while and take a break. You need to rest so that your body can go to work. Your body is so busy, especially during REM sleep. Can you imagine? We think that all this ADHD out there is just give them some drugs, right? Actually, a lot of it can be from bad sleep. Any questions so far? Everybody doing okay? I only see the chat on the restream, so I guess I only see the ones from LinkedIn. Okay, we'll go on. Yes, that was supposed to play. Hang on, let's go here. Click on that baby. He's not playing. Anyway, that guy was jumping around the whole car is what that was. And I don't know why the GIF's not playing. Hopefully I have a video too, so hopefully that'll play too. So snoring, right? We're going to right away talk about breathing because that's the biggest sign, right? So if your child is snoring at any age is not normal. Do not ignore the snore. If you're ignoring the snore, you could be having a lot of problems with your brain, with capacity. As you get older, it can lead to Alzheimer's. So don't ignore. These are all the kind of symptoms that we're looking for. So when you're asking, why am I on this live here with Simi Silver? This is why. Because all these crazy symptoms, all these things are behavioral things for the most part that you look at. Sleepwalking, teeth grinding, mouth breathing. All those kids, I can't breathe. They're all stuffed up. They develop long faces. That's what happens. That's the kid I can help. Bedwetting until they're 9 or 10. All of these things are signs to look for that you might see in your child or another child. So send them over. What else can we look for? We can look for, and this is just absolutely one of my favorite things ever, little pictures, because this is so everything, right? But besides that, I love how the baby's mouth is wide open. So look down their little mouths, right? That's what I do. I look in infant newborns' mouths. I'm looking for tonsils. I'm looking at their tongue. I'm looking if they have any problems breathing through their nose, right? Some kids you can hear across the room. Those are the kids I can help, okay? Mouth breathing, again. So our goal is mouth closed, breathe through your nose. No, I can't breathe properly like that myself, and I'm working on fixing that. We need to look down throats, though. Who's screening for this? This is a serious medical problem. If you diagnose it early enough, you can change the course of someone's life. You know, my son is going through all of this now. He went through dental school, exhausted, treated with a CPAP. You know, now he's starting to feel like, hey, energetic. Imagine. We're talking about relative, you know, levels of exhaustion. But if you diagnose it early enough, you can prevent it. Imagine being tired or diagnosed with this and the toll on your mental health, right? So you're told you're thinking you're just lazy. I can't get up early. You know, I can't think straight. Well, of course you can't think straight. You're not getting all of that brain nourishment and system replenishment. What else? Let's go on. So the risks of not treating this problem in children, which would be sleep apnea. I don't diagnose that, but I can certainly tell you if your child has a risk, and I can certainly hook you up with making sure we get a diagnosis and manage it. And some of these things are ADHD, failure to thrive, tired during the day, poor ability to self-regulate their behavior. Again, looks like ADHD. Like, this can be prevented. That's the good news. And I've been doing this my whole career. Just didn't make a bigger deal out of it, and I should have. I thought everybody was doing it. Now I know they're not. So in 2012 even, now this video hopefully will play. I'm not sure how to get these things to work, but essentially it's a 2012 video from a news channel, and there's lots of them out there where it talks exactly about what I'm talking about, and they interview ENTs and MDs, and I have no idea how to get it to play, so we'll just I'll go into unless I can figure it out here. Let's see if it'll play. If it plays, you can hear it, but I guess I don't know how to play it on the stream. So we'll do that another time, and I can post a link for you later, or I can post the video for you later. Alrighty. So again, this is personal for me. Even my mom has suffered. She's been in a wheelchair since she's 50 due to a connective tissue disorder, but she has suffered. I just thought that was normal for everybody to be taking puffers and taking decongestants and antihistamines, and she was just always stuffed up or coughing, right? Me too. I've been always stuffed up or coughing. There you go. So now what that does, now I can't necessarily fix stuffed up or coughing because that can have other reasons for that, but you can improve it so that you make sure the face grows and the jaws grow. Well, you can't, I can improve it so their face and jaws grow properly, so they have maximum potential, like whatever their potential is to have lots of air coming in. That's what I can do, so that you have a garden hose of an airway and not a straw, right? Like, try to breathe all day through one nostril. Just close your mouth for a sec, right? You're just not getting enough air in. You want to open things up and get that exchange of gases going with no effort. So these are some of the things you can do. Nasal strips are, if you go like this and you can't breathe too well, then you go like this, it opens up. That's what a nasal strip does. So go for them. Make sure you're not allergic to the adhesive, right? But this little guy here. So what's this little tongue tie? Ankyloglossia is the big word. And this little tongue tie here is what I evaluate and release. And within a week, I see babies, infants who are now breathing properly or better, nursing much better. I can't tell you how magical the treatment seems to be. I don't have a magic wand. You do have to do exercises after, but it is worth the effort on the parents, and because of all these risks. And that's what I'm trying to get out here today too, is the risks, because these are really serious medical problems, and this really does happen quite a lot. It's very common. So let's talk about that tongue. how is it that we can have a tongue that is an orthopedic organ? What does that even mean, right? It's going to sit right now. If your mouth is closed, tell me, is it at the roof of your mouth? Is the front of your tongue hitting behind your front teeth and then going all the way back in contact with your palate? Or is your palate too high? And so your tongue is resting down here and your palate's up there. Then you probably have a tongue tie. Or it could just be you were congested as a kid growing up, like me, which is why I have a long face, because your mouth is hanging open all the time to breathe. And yes, I have a high palate, which is probably why I'm not able to breathe well through my nose. So that's the tongue. You got to push every time, a little intermittent force when we swallow shapes our mouth. So if baby's mouth is open all the time, baby's nasal cavity is going to get smaller, baby's palate's going to get higher, and baby's going to have trouble nursing and breathing. And they won't grow their jaws properly because that tongue has to be able to hit that palate every time you swallow throughout your lifetime. So where should the tongue be? Tongue should ideally be just resting on the roof of your mouth in contact with your palate. So mouth closed, breathe through your nose. I can't, this side doesn't work yet, but carpenter's son problem, I'm on the list of like, get my own appliance done. So yes, I do treat adults as well, all ages. So this stuff though is where my mind blew up. So BioLase, again, back to my laser, was the reason I learned about this. I've had this laser for over a decade. And a colleague of mine was like, why aren't you treating the babies already? Okay, take a course. BioLase course. Wow. From Dr. Kotlow, Larry Kotlow. He's an expert in pediatrics, pediatrician, pediatric dentist himself, retired now, done tons of research. And now Dr. Ben Curtis has taken over for him. And if you really want to actually learn all about this, you should go to his event called Tequila and Tongue Ties with BioLase in Florida. It will teach you everything you would need to know if you want to be a provider. But in this case, though, I'm trying to share this because this laser is, I can't tell you how effective it is. And the babies are just calm afterwards. It heals very quickly. There's no bleeding, very minimal, and helps repair. That's what lasers do as well. So if you have any questions about that, feel free to ask. Otherwise, just send me an email if you want to, or, talk about whatever else you'd like to talk about. But how do you help, right? Well, you don't, right? You reach out to somebody, reach out to your doctor. If your doctor poo-poos you, come see me, I can help. And I would be in touch with your doctor. I'm not trying to put down any medical practitioner whatsoever. I'm trying to work together with them, collaborate, teach. And why is this a journey? It's not just a simple tongue tie release, right? And just because they can stick their tongue out also doesn't mean they don't have a tongue tie. It's really a professional evaluation that needs to be done. All right, so you have to continue. You have to keep going. You don't just do a tongue tie release, which is usually the biggest problem in the first place, because then as your kid gets older, I have to also evaluate if their jaws have not grown properly already. So we have to make sure that they catch up, right? And that's done with appliances, with myofunctional therapy, with a whole team of people that I work with and refer to and collaborate with in order to get your child breathing again. So this is the WaterLase. And again, there's the QR code for that. It's gentle. It also takes away cavities, which is pretty cool. I can do fillings with no shot as well. But besides that, this is an essential service. I'm in Brazil. There's a law that you have to check every baby and release the ties. There's usually a lip tie when there's a tongue tie, and that often gets released at the same time as well for similar reasons. So it doesn't trap the upper jaw and not allow it to develop. Now, I want you to think about that too, because if that jaw is developed properly, probably going to have room for every single tooth. Okay. And this also speaks to baby-led weaning, right? You want to make sure your child is using their jaws. No pablum. Don't puree their food. Give them a hunk of stuff, get them chewing, using their muscles. their jaw muscles. So where do we go from here? This is a very short presentation. Didn't want to keep you too long. Just wanted to enlighten you and share some information and let you know, because it seems that people are very confused about what I do and how I help. So I can't put it out there in a way. It's not like you're coming in for a filling, get a filling gun, go home, bye, right? You're coming in and it's a whole process. It's a thorough evaluation. We get records, we get images, we get pictures. We have a good time. Most of the kids love coming. And then we talk to you about what specific recommendations would there be for your child. So that's all I got to say this morning. And I would love if anybody had any feedback for me, positive or negative, questions. You can always reach out. My personal email is ssilver@rogers.com and professionally is Silver Dental. So I guess we'll call it. That's all that you got. I don't know if there's anything you want to review. I don't see anything else in the chat. So I'm going to assume everybody is happy today with all of this. And say good day. So have a wonderful day. And be in touch if you need me. Take care. Thank you. Thank you, Michelle. Eye-opening. Yes, this is what blows my mind, is that this information has been around forever. I learned a lot of this in dental school, not so much the breathing portion of it, which really tied it all together for me. And that's how I got to this stage as well, right? What can I say about ENTs helping? I think part of the treatment is often removing the tonsils and adenoids. Big part of it. If you look in the American Academy of Pediatricians, not dentists, the important part is take out tonsils and adenoids and rapid maxillary expanders. You have to develop that upper jaw. It has to grow, or those tonsils could come back if they're still mouth breathing. And just removing tonsils and adenoids is not always enough. Plus, here in Ottawa, we have one ENT doing surgery in the Children's Hospital. One. So there's an over-year wait. So these kids need help now. And if we can at least get them to start developing their jaw, often, those tonsils will shrink. So I hope that answered your question. If you have other questions, feel free to email me. Otherwise, I'm going to say goodbye. Have a great day. And vagal breathing is my other message. Do lots of it. That's your best meditation, when you just do those breaths where you're just breathing, and counting your breaths alone will help you to calm your nervous system and go to sleep. So I hope I didn't put you all to sleep, and hopefully I'll hear back from all of you. And I'm glad you all joined me. Thank you so much. I'm honored. Thank you. Okay. Have a great day, everybody. Bye-bye.